Ontario hospitals are in crisis, with hospitals warning of service cuts if the Ontario government doesn't substantially increase funding, with there being a billion-dollar structural deficit for hospitals, with several provincial hospitals having significant challenges with their budgets. And healthcare costs have gone up by 6% a year, largely due to an aging and growing population along with inflation. And with the absence of certainty about their revenues, they cannot properly plan for the future. This according to concerns raised by the Ontario Hospital Association president. And he has made it very clear that these structural deficits are things that efficiencies cannot resolve, and administrators will be forced to make difficult trade-off decisions in regard to limited resources. Let's look at Brockville General Hospital as an example. When the hospital was built in 2003, it was designed to have 19,000 visits per year and an average of 52 people per day. Instead, they are having 30,000 people dropping in every year and 82 visits per day, which represents 58% more patient volume than it was designed for. Meanwhile, Doug Ford has noted that the budget doesn't have space in order to increase funding. As he was celebrating a construction milestone at an upgraded hospital facility in his home area of Etobicoke, he suggested that the finance minister is worried about the growing healthcare budget, stating, "Do you know how much we're spending in health? We're spending $93 billion. It's gone up $33 billion. For reference, as of 2024, Ontario had the lowest amount of healthcare spending per capita in the entire country. For reference, the average provincial spend is $9,051 per resident, whereas in Ontario it is $8,250 per resident. So when you take that difference and you multiply it by the Ontario population, it means that Ontario hospitals are underfunded by approximately $13 billion compared to the average Canadian. But the Ministry of Health has made it clear that resources are very tight, with hospitals needing to do massive fundraising in order to keep up.